here at Michigan Parkinson Foundation. I want to thank you all for joining us. I think we have a really wonderful program today. It's going to be speech and swallowing issues in Parkinson's. We are very fortunate to have Alice doctorate.
Silbergleit.
Silbergleit, thank you.
You're welcome.
She has her doctorate in speech and language sciences disorders. She's with the Henry Ford Health System. She's the director of the program there. She's also speech and language pathologist, senior bioscientific staff department of neurology, and associate professor at the Department of Neurology at Wayne State University School of Medicine. Later on in the program, joining us will be Elizabeth Esqueda, who is the choir director for Motor City Upbeats Therapeutic Choir. It's a choir of folks who have Parkinson's. Both Alice and Elizabeth are going to talk to you about the value of singing in maintaining your voice and helping your swallowing muscles. So again, thank you so much for taking time. I know our healthcare professionals are so busy right now, so we are so grateful for you taking time to do this for us today. So,
you're welcome.
Dr. Silbergleit.
Okay, thank you so much, Mary Sue. So I will, as Mary Sue mentioned in that really nice introduction, I'm going to be talking about speech and swallowing problems in Parkinson and also voice. And we'll be talking about the choir toward the end of the talk, but I'm just going to start off with, as always, I have to disclose any relevant financial and non-financial relationships. So here they are, that I'm a paid employee. And let's just, you all know what Parkinson's disease is, but I always review that it's a progressive neurological disorder and it changes in a predisposed manner. I am trying to just, okay.
You good?
Yeah, I'm good, thank you.
Okay.
And it's the abnormal formation of Lewy bodies and Lewy neurites that occur at defined sites within the brain, and it progresses topographically in a predictable sequence. So it starts in the medulla, in the brainstem, and these Lewy bodies form, and they're abnormal aggregates of protein, and they develop in the body of nerve cells and in the cell extensions called neurites. And they displace other healthy cells and create havoc, as you know, in the body. The prevalence of Parkinson's disease in individuals under 70 was 180,000 in the United States in 2005, and that's predicted to increase by 40% to 250,000 by the year 2030. Well, how common is dysphagia in this cohort of individuals? Most research puts a range of 25 to 90% prevalence. In general, we know that at least 80% of individuals with PD will develop dysphagia sometime during the course of their illness. Usually their swallowing is, but dysphagia is the term for swallowing disorder. So usually swallowing is better in the on phase with levodopa, and actually swallowing disorders or dysphagia was mentioned by James Parkinson in the very first essay he wrote on the shaking palsy in 1817. So it's not as if we all of a sudden discovered, oh, patients with Parkinson's disease have swallowing problems. This was one of the first manifestations over 100 years ago when the disease was first noticed. All right, so what happens when we swallow? There are three phases to swallowing. There's an oral phase, a pharyngeal phase, and an esophageal phase. So when you eat, when you put something in your mouth, you start that motion of rotary jaw motion. Your tongue starts to move in a rotary manner, and then when you're ready to propel the food, you move your tongue back to the back of your mouth, and that triggers what we call the swallowing reflex or the swallowing response. Your soft palate elevates. The epiglottis, which I'll show you, inverts to protect the larynx. The larynx kind of tucks under the epiglottis so nothing gets aspirated. And the bolus moves above the epiglottis into your esophagus. And then we have these peristaltic contractions of muscles that move the food into the stomach. So what do we see with Parkinson individuals with PD? We see a repetitive tongue movement. Just like it's hard to start walking, that there might be some start and stops in movement, the same movement happens to your tongue. That muscle doesn't just smoothly move food back. It might move forward and back, forward and back, forward and back, until it finally gets that food going to the back of the mouth. And overall, swallowing might be slower. The chewing might be slower. The manipulation of food might be slower. In the pharyngeal phase, we see a little slower stripping of the muscles. So food might end up staying in these pockets in our throat longer than we want them to. And if they stay there and we put more food in our mouth, there's only so much space there. So the risk of aspiration or the risk of food or liquid going into the airway or down the wrong pipe increases. And then in the esophagus, there's slower peristalsis. So I think a picture is worth 1,000 words. So I hope this works. I'm going to show you what we call a modified barium swallow. So you'll see what it's like when you swallow. And when individuals have trouble swallowing, typically the neurologist will refer them to speech pathology. And we will see a patient and examine their mouth, their voice, and we might give them something to eat or drink in the office, or we might go right to this exam, which we call a video fluoroscopic swallowing study. And we are looking at the oral phase and the pharyngeal phase and the esophageal phase. And we want to know if patients are efficiently swallowing. Is anything going down the wrong way? And if so, how can we help you or individuals with PD not prevent aspiration? And so we do the swallowing study, and keep an eye on it, because if you blink, you'll miss the swallow. That's how fast things happen.
Normal Swallow Tutorial with Modified Barium Swallow by Dr. Christopher Chang of Fokker ENT Consultants. These are a variety of substances.
So I want to show you here that when we do a swallowing study, we typically have different consistencies for individuals to swallow, because we want to know if they swallow better with liquids versus solids, pudding versus a cookie. So we give the people a variety of food to swallow. In this example, this looks like they have grapes or applesauce. And so we add barium to the consistencies so that we can see inside the body. We need the barium to see inside the person. We can't just have them swallow a cookie without barium. We would never see it on X-ray. And so we add barium to the consistencies, and now we use barium of different consistencies. So we use a barium that's in the consistency of honey and in the consistency of pudding. So we don't have to actually use pudding, we just use the barium. And then we would put barium on a cookie or a cracker. And we frequently tell patients to bring in a food that gives them particular trouble. And we just put a little barium on it, make it a little barium hors d'oeuvre, and have the patient swallow.
A patient will ingest during a modified barium swallow study.
So here, you'll see the swallow in a second. The person just sits there and drinks. Okay, boom. That's how quickly the swallow happens. That's a normal swallow. It's a little fuzzy in here, but the bolus is in the mouth and it goes right down the esophagus.
Here's what the swallow ensure that we can see this. We're not seeing the video.
Really?
I can see it. Can't see the video. Could you send it? Other people are typing in that they can see everything.
There's this thing that says stop video. Is that unchecked in the person who's calling in?
Yeah, stop video is for displaying your own face
right.
on it, yeah.
Yeah, I don't know.
Could that person see all the other slides?
Can you see the slides?
No. No,
Oh,
we haven't seen anything except you, the speaker.
Oh,
So there should be a box in your top right corner that says speaker view or gallery view. Do you see that?
No, we don't have that. I mentioned that earlier, that there's no gallery view option.
they're on an iPad, Kelly. Does that make
Oh, yeah, it might. I have no idea.
X-ray fluoroscopy.
All right. We'll have to go to the computer. And sometimes it doesn't work on the computer, but I'll try.
Well, we are recording this and we will send it to you, okay? So somebody wrote if you're on an iPad, they have to swipe left.
Oh.
I don't know if that,
Swipe
I don't know what that means. If swipe left, it says. Somebody made that suggestion.
I'm trying. Screen share.
Would it be okay if I continued?
Yeah, go
Okay.
ahead. We're recording this, so we'll send it out to others, okay?
Yeah, we've got it now. Thank you, whoever.
All right.
Oh, good.
Good.
Okay. So I will just go back to show that video of the swallow on X-ray for the new.
Here's
So you can see how quickly that happens. You blink and the swallow is over. Now you'll see what happens when you scope what's
what the
happening in our
swallowing
bodies
looks
when we
like under
swallow.
X-ray fluoroscopy. And this is what it looks
So
like from the inside using endoscopy.
okay, so I just wanted to point out in this picture, this is the epiglottis, this structure here. And you saw how it moves forward, covering the vocal cords. These are the vocal cords, this white tissue here. And this is the trachea. We don't want food or liquid going down the trachea because that leads into your lungs and can cause pneumonia. So this area is called the larynx. And the larynx, which includes the vocal cords here, tucks, it raises up and tucks under the epiglottis. So food is directed into the pharynx or the throat, which is here.
Note that during swallowing, the epiglottis folds downward, covering the trachea, preventing aspiration.
Okay, so you can see that that is a very fast process. Now, what are some things that can happen in individuals with Parkinson's disease? Well, we may get a little bit of food and liquid going down what we call the wrong pipe. So watch what happens in this video. Okay, I'm going to go back a little bit. It's very slight, but do you see this dark line here? That's a little bit of this thin liquid that tucked under the epiglottis and made its way into this laryngeal vestibule area. This is called laryngeal vestibule penetration. The liquid here penetrated into the laryngeal vestibule, and I'm going to show it one more time. Oop, I keep missing it. Okay, so I want to show you you can see this right here. That we don't want to see. You see the epiglottis, boop, popped back up, and how it protects the vocal cords and the airway right there. Okay, this is a great view. This is the epiglottis. this white structure here. The black is the barium. Even though it's white when we drink it, it shows up as black in the body. And so what happens here is that the barium, looks like a lot of barium that this person took. Some of it's going down the right way into the esophagus. Some of it snuck under the epiglottis because the timing was off. Perhaps it was an uncoordinated swallow. We don't see much in the oral phase to really know what happened there. And this barium is seeping toward the laryngeal vestibule. Your vocal cords are about this area, and this space is the trachea. So we don't want to see anything going into the trachea. Now, this is someone with a disordered swallow, not necessarily a Parkinson individual. These are just tapes of what would happen if someone were to have these problems. And on this video, you'll see that the swallow is inefficient, lots of pooling here, and boom. That's what we call, oops. This is what's called aspiration. This is when food or liquid goes into the trachea. And this is a very serious condition because, as I said, it can build up in the lungs and cause pneumonia. And the worry with individuals with Parkinson's disease is that they don't usually sense this happening. So they have what we call silent aspiration. They wouldn't cough if this happened. If someone without a neurologic disorder with an intact swallow were to aspirate, the first response, and I'm sure many of you, we've all had that, where we maybe start to talk and we still have food in our mouth, and all of a sudden we're coughing. And that's our body getting rid of something that went down the way it shouldn't have gone. So just to show you that these are things that we see in individuals with Parkinson's disease that we want to prevent. So what are some ways that individuals with PD can know they're having a swallowing problem, and when does this happen? So some recent research that I did at Ford with my colleagues, we looked at 369 individuals with Parkinson's disease, and we gave them the Dysphagia Handicap Index, which is a questionnaire on how one perceives their swallowing. So some of the questions are, for example, as I wrote here, I cough when I drink liquids. I'm afraid I'll choke when I eat. I have to change my diet to make it easier to eat. So if any of these things are happening, those are problematic, and you should tell your doctor immediately. And so what we wanted to look at was, when in the stages of swallowing of PD, do people start to recognize there's a swallowing problem? What happens? And we divided individuals up into 0 to 4 years since their diagnosis, 5 to 9 years since their diagnosis, and over 10 years. And because symptoms are so subjective, we didn't go with when symptoms first occurred. We went with when the individual saw the doctor and that first diagnosis of PD was made. So we know that patients in the 0 to 4 years may have had Parkinson's disease 2 years before they ever saw their doctor. But in order to have the most objective data, we divided the groups up to that first time that there was a medical diagnosis of PD. And so what we found is really the self-perception of swallowing in individuals with Parkinson's disease was the same from the first time of diagnosis up to 9 years. There was no difference between the first two groups, the 0 to 4 years since diagnosis, the 5 to 9 years. However, when individuals had the disease for 10 and plus years, there was a significant difference in their perceptions of swallowing compared to the earlier diagnosis groups. So it seems that individuals with Parkinson's disease don't recognize swallowing problems until later in their illness. And we do know from research that if someone has Parkinson's and they recognize swallowing problems very early on, those individuals are sometimes end up with a diagnosis of Parkinsonism, not true idiopathic Parkinson. There might be other things going on. So while we wouldn't expect to see swallowing problems right away when someone's diagnosed, it's not out of the realm of possibility that that can happen. And you can still have idiopathic Parkinson, but it could also mean there are some other medical problems going on. So you might be asking, well, heck, I got DBS. Didn't that help my swallowing? And the answer, unfortunately, is probably not. So another study that we did several years ago looked at 25 patients who had deep brain stimulation. And we performed swallowing study and the dysphagia handicap index before their DBS, 3 months, 6 months, and 1 year following their DBS. And what we found was that there was no change in swallowing based on blinded raters. People rated the swallowing and they had no idea if someone had DBS or not. Or if they did, they would know they did because you could see the leads in the x-ray. They didn't know what stage they had had their DBS, if they were a year out or only 3 months out. And so what we did notice is that there was a statistically significant improvement in the dysphagia handicap index scores from prior pre-DBS to post-DBS. So while there was no improvement statistically on the swallowing studies, individuals with PD may perceive improved swallowing. And on Tuesday, there was a gentleman talking on this format about a placebo effect from some studies that he had been involved in. And it was very interesting. One of the things that he mentioned was that individuals with Parkinson's disease are always so ready to participate in research. And I have found that too in all the research I've done. You know, the individuals with PD are just the nicest people and wanting to help in any way possible. And so this gentleman brought up a good point that I just threw in this slide, that the idea that something might help and improve someone might release dopamine, which creates this feeling of feeling better anyway. So you might think that the treatment is working. And there's nothing wrong with that. That's great. So I'm just letting you know that some of the things that that we look at, and we look to see if things are helping in the area of dysphagia. So there are several strategies that we can do. There are exercises that we do with individuals to improve swallowing when we see what the results of their video fluorographic swallowing study is. And there's something interesting coming out in the world right now called expiratory muscle strength testing. And there have been a few studies that indicate that there could be improvement. Now, I meant to include a picture of this device, but it's a small device, and you exhale forcefully into this device. And it's not something for you to purchase on your own. It's something for you to see a speech pathologist and your doctor to approve it. And which is one of the reasons I didn't want to just put all the information in, because I don't want people just going out on Amazon and buying this and doing it. It really needs to be a supervised therapy. And so there are some positive, information coming out about the expiratory muscle strength testing. It does still need a lot of work, but there was a recent study in Florida, well, I guess 10 years ago now, and the jury's still out, but we are trying it with some patients, especially patients who might have some vocal cord weakness. And so the idea behind this is to strengthen those muscles that bring the vocal cords tightly together, and also that help your respiration give a good oomph. And so what people blow hard into this device, and it's almost if you've ever blown into spirometry, where you have to, if you've had any lung problems or you've been in the hospital and they give you a little mini plastic spirometer to keep your lungs going. So with this device, we're working on improved coughing to expel anything that does drop into the airway. So patients went through a series, several weeks of training, and they had a they had a sham group and they had a real EMST group. And then they had people blinded, not knowing who was who, and rating their swallows. And they did show that with this forceful movement, the larynx elevated greater, and there were improved penetration aspiration scores, which is a scale that we look at to rate how much someone has penetrated or aspirated. And they had improved cough. So it does need more studies, especially for maintenance, because what they found is that after the period of practice is over, patients tend to revert back to their pre-practice levels. So now most of the studies are working on how do we maintain this without creating fatigue or excessive muscle use. So in summary for swallowing, I'm just going to say, let your doctor know of the first sign of difficulty. Many individuals might think, oh, this is part of growing old. This is part of aging. I might have a little bit of a slower swallow. I might cough. Well, it is possible, but it's also possible it's due to a neurologic problem that needs to be addressed immediately, especially since that silent aspiration is such a common symptom of PD. We really cannot, if someone were to aspirate in our clinic, we wouldn't know it because the patient wouldn't cough. So the most important thing is to get that video fluoro study so we can actually see inside the body and we can see if aspiration is occurring, and then we can treat you. So some of the treatment strategies, we teach people to swallow a different way. We might have them hold their breath when they swallow. We might have them turn their head a certain way if we see pooling in one side of the throat or the other. We might have them change their diet, or we possibly might do some EMST training depending on what the results showed. Okay, we're gonna segue into speech and voice. How many of you have ever heard this from people? We hear it from our patients a lot, especially from their spouses. I can't hear a word they're saying. I ask them to repeat all the time. No one can hear me, my voice sounds raspy. So these are complaints that we hear from patients and we know can occur in individuals with PD. So what happens to our speech mechanism when PD is in play? You can have tongue rigidity, just like you can have leg or arm rigidity. Difficulty initiating speech, just like you have difficulty initiating walking. There might be impaired coordination between how we breathe, how we voice, and how we speak. And then one of the main areas that is the classic feature of voice problems in PD is the hypophonia, or very low vocal volume like this. For speech, we refer to speech as the sounds and words we produce by moving our articulators, our lips, our tongue, our soft palate. Some individuals with Parkinson's disease may have what we call palilalia, which is a repetition of sounds or words, usually the initial sound or word, before it's actually spoken. So it's not like developmental stuttering, but it sounds a little bit like stuttering. And it's usually in the initiation of a word. So that's how the disease can affect your speech. We also look at prosody. So many times individuals with PD have mono pitch, mono loudness, just like this. They might talk like this, and they might talk really fast. Those are classic signs. They have been identified since the early 1960s from the Mayo Clinic research that Darley, Aronson, and Brown did. And these are classic signs of mono pitch, no loudness, short rushes of speech, and that creates a flat way of presenting oneself. And typically, of course, all of these combinations can occur at the same time. Sometimes we might see someone initially for voice therapy who has excellent speech, but just some low volume. And so we work on what we need to after we assess the person. The voice changes that we, and by voice, I'm talking about the larynx and the vocal cords. So the vocal cords start your voice, just that sound of the vocal cords vibrating. And we put that together with speech as those air vibrations rush up through our vocal tract, through our pharynx, our mouth, our nasal cavities. So just talking about the voice, Some of the things that we hear are breathiness, like this. It could be harshness. It could be strain. It could be tremulous. It could be very quiet. So those are the voice characteristics that we hear in individuals with Parkinson's disease. I'm going to show you a videotape right now of healthy vocal fold vibration. This is a female larynx, and it looks the same as a male larynx. And this is a singer that is volunteering to have her vocal cords looked at by this doctor. This is the right true vocal cord. This is the left true vocal cord. This is the epiglottis. These are the arytenoids. They help bring the vocal cords together and apart. So take a listen.
Here is a look at some normal young female vocal cords during a stroboscopic exam.
So notice when she takes a breath, her vocal cords open. That's the trachea underneath. And you want to look at how symmetrically they vibrate. So she went into a low pitch. When we test vocal cord motion for men and women, kids, 100-year-olds, 10-year-olds, it's the same. We test different pitches so we can see how the vocal cords move. And we also test just quiet breathing so we can make sure the vocal cords are opening and closing, that there's no paralysis of the vocal cord, that there are no bumps on the vocal cords. This is high pitch. You see them stretch. That's even higher. Okay, so that's healthy vocal cord vibration. Now, let's look at a larynx that has tremor in it. That could happen with individuals with Ph.D. Notice the difference. So, this is this person's epiglottis. Again, right true vocal cord, left true vocal cord, arytenoids. These are spaces in the pharynx. This is the pharynx. Remember we saw for swallowing, the epiglottis tucks to protect this, and food's directed here. Notice the shakiness. There's no sound with this. But you can see how difficult it would be to talk if your larynx is shaking so much. So you can see that you would get a tremulous voice if you were trying to manage that part of your body. And I also want to show this to you because we see this a lot. First of all, as we age, our vocal cords get a little bowed. Notice in the first exam how straight the individual's vocal cords were. And then as we age, the muscles kind of relax a little in there, and we might get this bowing shape. You can almost see in this person, the right vocal cord is bowed a little bit. It's almost like there's a divot here. This vocal cord's nice and straight. This one is bowing out a little bit. We see this a lot in individuals with Parkinson's disease, and it's usually an effect of aging, not from the disease.
Low in pitch, and breathe, stick your tongue out a little bit further, and in.
Okay. Right there. Oops. Sorry. I don't know why these things.
Low in pitch, and breathe, stick your tongue out a little bit further, and in.
Okay, this is a classic bowed look where the vocal cords are touching here anteriorly and here posteriorly, but there's this big space in between. So because the vocal cords are not touching here to valve and control the air coming up through the trachea, you get this very breathy sound. The air is just whoosh, escaping. And So we do vocal exercises with people to try and get those vocal cords coming together again. Sometimes I'm just going to go back. Sometimes, and we've done this a lot with individuals with PD that we're working with.
Tongue out a little bit further and
Okay, when they have this bowing, when they have this bowing, we can refer them to an ear, nose, and throat doctor. Usually we try and do voice therapy first. And if the patient has bowing and they perhaps haven't progressed as much as they want in their voice therapy, the doctor can inject some material in the bowed vocal cord to thicken it so that the two vocal cords touch each other more and they get a stronger sound. Okay, so what's the relationship between voice and motor performance in Parkinson's disease? So we looked at acoustic analysis of voice as a way to try and predict staging of PD several years ago. And we had a control group of 22 individuals, a healthy group, and we had individuals with Parkinson's disease, about 26 individuals. And we divided the group with Parkinson's disease into mild and moderate Parkinson's disease based on their UPDRS scores in motor function. And that's the Unified Parkinson's Disease Rating Scale that the doctors use. And we compared vocal acoustics. We looked at sustained sound, we looked at frequency of the vocal signal, amplitude of the vocal signal, how much range someone had. And the results showed that there were significant differences in semitone range of the control subjects and the moderate PD group. So individuals in the earlier stages of Parkinson's disease still had a good vocal range compared to a control group, but as the disease progressed, that range shrunk. And there were also significant differences in semitone range for males between the controls and the mild PD. So the males with mild Parkinson's disease had a reduced range of frequency than the females, and also controls versus the moderate PD. And we also found significant correlations between the acoustic findings and the activities of daily living and the motor portions on the UPDRS. So our conclusion was that acoustic analysis of voice, particularly frequency range, may provide a quantifiable correlate of disease progression in Parkinson's disease. So we probably should be looking at how many semitones an individual could sing as a possible means of saying that their disease is progressing. So what are some of the therapy options people have? Perhaps someone could chime in. I imagine with 30-some people on the line, someone has had some form of Lee-Silverman voice treatment. And so Lee-Silverman voice treatment was developed almost 30 years ago through a group at University of Colorado. And Lee Silverman was a lady who had Parkinson's disease, and she donated the funding for this research. And there have been many publications over the years about the benefits of Lee Silverman voice treatment. And this is a very hierarchical, regimented voice therapy. Sometimes in voice therapy, we might just work on breath support. We might work on coordination of breathing and voicing. But what they discovered, specific to individuals with PD, that just working on being loud was all that was needed to improve speech, to improve facial expression, and to just not have to think about anything else. Because we know there are times when individuals with PD have a lot to think about. How to walk, how to talk, how to not fall, how to balance yourself. They just decided we're only going to work on loudness. And so this is a 16 session approach. It's 4 days a week for 4 weeks. And we go through a hierarchy of 15 sustained sounds, 15 pitch glides up, 15 pitch glides down. We're working on frequency range. We're working on vocal effort. This is particularly beneficial. As soon as someone gets diagnosed, we like to start this treatment so that individuals know how to use their voice, how to practice it every day to keep their voices healthy and not fall into that real low voice like this. And after the pitch glides, we work on functional phrases, the same 10 functional phrases the individual has made up for all of our sessions, and then finally conversation. So it's a hierarchy of just having to sustain sound all the way through what it takes to converse, where you have to think about what you're saying as well as how you're saying it so that you maintain that loudness. The research has shown there's a 2 to 4 decibel increase in volume, but these are in-clinic assessments. And one of the things one of my colleagues is working on is looking at some devices that individuals can use at home to compare to LSVT as far as keeping your volume up. And there's something called a spread effect. So just working on the loudness, they've noticed improves articulation and facial expression and swallowing. And there's a lot of research on this. So it really gets, it's a high energy, high effortful type of therapy. And the one thing the individual has to think of is be loud. Many people think they're shouting and they'll say, I can't be loud, I'm a quiet person. But what it's that sensory feedback that gets diminished with PD. So what sounds like normal voice to a listener sounds like shouting to the individual with PD. So when they start talking, they think, oh my gosh, I'm shouting. And it takes a lot for us to convince them, you're not shouting, you sound great. It's just that you have to use more effort to have that medium voice, not the loud shout. And we're never working on shouting. We always keep the decibel level under a shout. And again, as I said, if someone has improved but still has some breathiness to their voice, and actually every patient that we see gets an ear, nose, and throat exam to make sure there's nothing else wrong with the vocal cords, that the effects we're seeing are solely from the neurological symptoms of PD. So if someone does have bowing, they might opt for augmentation in addition to LSVT. So I want to show you, these are some apps that you can download. Right here, it says Decibel X. And so I use that app in clinic with patients, and now that we're doing teletherapy, and actually even in clinic, I would have patients download this app onto their phone. And this app shows you how loud you are. So you can practice being loud at home. And I'm not talking about shouting. I'm just talking about not whispering and not being so low that your spouse or partner or caregiver or family has to say what all the time. You want to be loud enough to be heard. And then there are some pitch apps too. So this one is called Voice Analyst. And this app shows you volume and pitch. And so here's an example of a graph that you would get. So this is me going from like a low note at about like 130 hertz, all the way up to almost 500, little vibrato right there at the top, and then a smooth glide down. So you would get these readouts, and these are really great to practice at home. Just practice your pitch, try and extend that frequency range. So maybe the next time you reach 500, or you get lower than approximately 140, 130. And those are just fun things. They're free apps. Actually, this one might be $9.99. The Voice Analyst might be $9.99. The Decibel X is free. Okay, so frequently after someone has completed their month of voice therapy, we see them back after they've done LSVT, and we ask, how are things going? And sometimes we get, great, I keep practicing. Frequently we get, I haven't practiced, I live alone, I have no one to talk to, or my spouse caregiver has to bug me all the time to practice. And when patients don't have the accountability of coming in every day, seeing the clinician, showing us your homework, working on it with us, sometimes motivation tends to drop off. So I started thinking about this actually years ago. And finally, last year, I had the opportunity to meet Elizabeth Esqueda, who is a vocal performer, has a master's in music, and we've collaborated on a choir. That singing is fun. There's research that I'm going to present to you right now about the benefits of choral singing in a group. So one of the things that we did was start something called the Motor City Upbeats. And the idea and the motivation behind this was to help individuals who've completed voice therapy maintain their voice in a fun, social atmosphere to keep that motivation going. And it's been such a joy. The group has had performances, they practice weekly, and so we'll go into more of that after, but first I just want to explain a little bit. In this section, we're going to talk about enhancing voice therapy and the benefits of a therapeutic choir and the development of the Motor City Upbeats. So there has been research, recent research, about the benefits of group singing. So in this particular study, 27 individuals with Parkinson's disease were divided into two groups of singing, choir singing. Some of the individuals had LSVT beforehand, but none of them were adhering to the exercises. In the previous research, we know from LSVT shows about a 2-year effect, but that's again bringing people into the clinic and measuring their volume. I will tell you, I have a patient with whom I worked 10 years ago, and I run into him in the community, and he's active and he's in his 80s, and he still works a little bit, and he tells me every time I see him, Alice, I do my exercises every single day, and if I didn't, my voice would not be as good as it is. And his wife confirms that with me. And in fact, he told a cute story that he was doing some loud ahs at a stoplight a couple of years ago, and someone came out of their car and asked him if he was okay because they didn't know why he was doing like repeatedly, and his window was open. So anyway, in this particular study, subjects were selected to either participate in a 1-hour group singing session or a 2-hour for 8 weeks. And then they also divided the group into having 1 session a week. Well, actually the 2 sessions a week is the 2 hours. So the sessions were led by music therapists, and the same technique was implemented for both groups. So there's 18 subjects having this singing group 1 time a week, and there are 9 subjects having this singing group 2 times a week for 16 sessions total. Okay, they did some baseline testing on medication at approximately the same time of the day. So patients or subjects sustained ah and e, and they measured how long they could sustain sound using a stopwatch. They measured their frequency range using an app on an iPad and converted it to semitones. And they measured how loud they were by using that decibel meter app I showed you on their iPad. And they also measured breathing conditions using a portable respiratory pressure meter, and that measured inspiratory volumes and expiratory volumes. So the subjects also completed quality of life questionnaires. The vocal related quality of life is a common questionnaire. And they wanted to look at how patients' voices affected their quality of life. They also had questionnaires from the World Health Organization, which looked at psychological, social, physical, and environmental factors on quality of life. So the same script was used for both groups. They did abdominal breathing warm-ups quietly with mirror cues, and then they set up music for the first 2 sessions. They worked on lip buzzing, on glissando practice, messa di voce, which Liz will talk about, which is holding a single note, increasing intensity or volume, and then backing off again. So all of these practices are meant to promote vocal use in a healthy way and to improve strength of the vocal cords and frequency range. So there was a sound level meter set up in the room at each practice, and they did the same songs, they received the same recordings, and they also practiced at home for 30 minutes twice a week. So their results showed there was significant difference within each group from the pre and post respiratory measures. So people had greater lung volume as they were practicing. There was no difference between the groups for respiratory measures, but within each group, they improved. There was also significant improvement in both quality of life measures for both groups. No difference between the two groups, but within each group, there was improvement. There was significant improvement in lip buzzing, glissando, and phrasing. And the overall, there was gradual improvement in all intervention measures between the two groups over 8 weeks, although it wasn't statistically significant. But what that's telling you is that between the groups, there was no difference. So it doesn't matter if you do this practice 1 time a week or twice a week. There was still improvement within each group, but between once or twice a week, it didn't matter. And so this is important because we have our Motor City Upbeat practices once a week. And this research is showing us once a week is okay. You don't need twice a week. We've been doing some twice a week for fun online, but in order to get the benefits, once a week is just fine. So in summary, we use this to kind of guide us that group singing can have an effective means of improving overall quality of life in individuals with Parkinson's disease. And there was another study recently that just looked at a thematic analysis, which is just identifying common themes, interviewing people. So they had people with stroke. There are lots of choirs out there with individuals with stroke and other disorders. And in fact, even though our Motor City Upbeats is primarily for individuals with Parkinson's disease, we have individuals with a variety of medical and neurological conditions, and we're open to everyone. So we don't just limit it to individuals with Parkinson's disease. And so in this group, there were 8 people with stroke, some with Parkinson's disease, recruited from a community music therapy choir, and significant others. And they were all interviewed. And their final result was that the choral singing participation was described as an enjoyable social activity. Participation was perceived as improving mood, language, breathing, and voice, and to help self-manage some of the conditions. So we were fortunate. Liz and I started the choir 1 year ago, actually May of 2019. And just recently, we received some philanthropic support, which we're very excited about. And so we're working on that. We have a donor who is going to help grow the choir with us. So we're really excited about the future. And we've had some really nice performances and very happy about it. So at this point, I am going to stop sharing my screen, and I'm going to ask Liz to open up her screen, and she will talk to you about the Motor City Upbeats. Thank you. Are there any questions before we move on, or we can save it all to the end?
Yeah, why don't we save it to the end?
Okay.
Questions, put them in the chat. Can everybody, if you kind of hover your mouse either over at the bottom of the screen or the top of the screen, you'll see chat.
Oh, I see.
You can type a question in there, okay? All right, we give you Elizabeth.
Hi, everyone.
Yay, there she is.
Wow, this is very exciting, and we're so happy to see so many of you here to get good information and to also hear some other options for you. I am going to see if I can share my screen. If you hold on for just a moment.
Liz, while you're doing that, could you tell us a little bit about your background?
Sure, and also, have I been given host capabilities yet?
Oh, Kelly, can you give Elizabeth Esqueda host abilities?
Yep, you want me to give Alice host abilities?
No, Elizabeth.
Oh, Elizabeth, okay. Yep.
Yeah, do you see her? She's right underneath Alice. ESQUE, do you see it?
Yep, I see her. Give me 1 second.
Okay, all right.
Mary Sue, it says that you're the main host and I'm the co-host, so I have to take.
You want to take me off as host? Can you do that?
Yeah, give me 1 second.
Okay.
While they're figuring that out, I can speak a little bit. So my background is as a performer and private voice instructor. Can everybody hear me?
Yeah.
Okay.
Yeah, we can hear you.
And group voice instructor. And so that's what I bring here is I'm very passionate about vocal health and music and performance. Music has always been such a wonderful part of my life, and I just really enjoy sharing that with other people. Especially if I can help them enhance their own voices, increase their own enjoyment through their increasing of their abilities in singing. All of that is just wonderful to me, and I really love to work with people, and I love to work with music. So let's see if I can.
Yeah, you are a co-host now, so you should be able to share.
Let me see if I can pull up here. Okay. Give me just one moment. Yes, it's been quite exciting to bring our programming to go from meeting in person to now online. So we're all adjusting to, I see, here we are, how we can bring programming to all of you at home. And let's see, here we go. Oh, good. All right, let me know if you can all see this. Can you see what
it? Yeah.
Do you need me to move anything over? Let's see.
If you want it to be full screen, can you hit slideshow at the top and then go from the beginning? Right there. Click on that.
Okay.
And then it should say from beginning, which is all the way over to the, yeah.
From current slide.
There you go.
How's that look?
It looks great.
All right, so here's a little bit. Alice already mentioned that we actually came into contact through a voice student that I had. And so she knew me as a private voice teacher. And although my background is not specifically in choral direction, a lot of our sessions do function as group voice training and group voice exercises. And I just have to say that I'm so pleased with, the wonderful thing about regular instruction and weekly instruction and regular students and choir members is that you really also start to build a community. And that's the other thing that we really wanted to do, was create a community of people that maybe were facing similar challenges and who had things in common and could come together and become comfortable with one another and enjoy singing with one another. And we have tried to continue that community feeling as much as we can online. So you can see here, I wrote down here that as Alice mentions, we do welcome all individuals with not only Parkinson's, but other medical and neurological disorders. We also, especially when we were meeting in person, which we will hope to do as soon as we can, again, as soon as we feel that it is comfortable and safe to do so, then we will resume. And caregivers and family members are very welcome to assist and to come. Right now, absolutely. If it's at home, feel free to have plenty, several people around the computer and to join in singing together, because that community aspect is so lovely. There really is no singing experience that is required, We have different members that come with different backgrounds in singing. And the idea too is that this is a therapeutic choir. We're all there to learn and to enjoy and never to judge and never to feel self-conscious. So part of that community is building that trust, because the voice can be so subjective and personal and expressive. That's another wonderful aspect of meeting regularly with people that you get to know. Online sessions, and as well as when we were meeting in person, are around 75 minutes, about an hour, hour to hour, 15 minutes. And we start with some light physical stretching. We talk about things that affect the voice and affect the body and how your voice sounds, like things that maybe even people might not think about, posture and feeling released and not tense. All these things can actually have a great effect on the sound of your voice, whether it's through speaking or singing. So we have light physical stretching and breathing exercises. Not only do the breathing exercises help to open up the throat, really maximize the use of all your breathing apparatus, and but it also helps to calm and center. That helps with the enjoyment and the relaxation. We have singing warm-ups that we do, and we talk about vocal technique and good vocal health and how to maximize the sound that you have right now, there are ways that musicians and singers can approach singing or speaking in a way that really amplify the sound without pushing. We use this through resonance, through a ringing sense of the voice. And we talk about how to feel that and how to tap into that, and to do that in a conscious way so that you can take these skills and apply them at home or with your friends when you're speaking, that you really feel confident and you know how to do these things for yourself. Let's see, we also learn musical skills. And I wanted to mention too, there's something that we use in choirs that are hand signals. And the wonderful thing about these hand signals too, whenever we're looking at exercises, I always try to think about how can an exercise, any specific exercise or warm-up, how can it really serve all of us in more than one way? So many times in singing, this happens automatically. As you're singing, you're also working on the breath. You're also thinking about where the pitch is in terms of training your ear. But also, if we can add other elements to it, it just gets the brain firing in so many different areas, which is just really healthy for all of us. So one thing I can see now, I'm talking with my hands a lot because I'm thinking about these hand signals. So if there's something, those of you have seen the Sound of Music and are familiar with the song Do, Re, Mi, the do, a deer, a female deer, etc. We've got the Do, Re, Mi, Fa, Sol, La, Ti, Do scale is called the solfege scale. And there are certain hand gestures that go along with this. So one thing that I've added, many choirs, many standard community choirs or church choirs or synagogue choirs use some of these techniques as well. But we try to add them to us, not only because they're good for us as singers, but because they're great for stretching the hands. I try to really think about other challenges that people with Parkinson's or other medical or neurological disorders may have. And so we do hand stretching and work on the hands as we add the hand signals. So I wanted to just kind of use that as an example to say that my goal as an instructor and director is to try to bring multiple disciplines together to really help that we can really have, that I can bring the maximum benefit to the choir members. So we do Do, Re, Mi, Fa, Sol, And this allows us to work our hands as well as our voices, as well as our brains, all at the same time. And that kind of challenge, although it's a fun kind of challenge, then it's really rewarding too. You feel really good. You might not know it at first, and then you gradually get to know it, and you feel very good about that too. In addition, we have our song learning time and sing-alongs of our practiced songs. And now I have to tell you, I'm very excited about this next part. I just wanted to highlight before we move on to some of our examples of the choir, is that now that we're on choir, now that we're online, I've been trying to think about additional programming that we can do that will help us to feel connected, even though we're all at home. So we've talked about adding some sing-alongs with family and friends, and then maybe some monthly social gatherings as well. We talked about online karaoke and cocktail or mocktail parties that we could all have fun singing for one another as well as singing together. There are also ways online that you can do movie and musical watch parties together. So we could watch a movie or a video together. And then also, the choir members we just love to laugh and have fun with one another. So we could do a comedy hour as well online, because that kind of laughing, ha 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 ha, and getting the breath and the voice going through a very natural way is really healthy. So we're very excited about the online programming that we have coming up. I wanted to show you some examples of the choir in action. Alice mentioned some of some of the skills that they worked on in their research. And I'm going to show you a little bit about the choir. So this is where we're encouraging, this is a clip of abdominal breathing. So using the abdomen to breathe deeply and to use that as support, and encouraging a sustained singing sound and energetic sound. So let me play this for you. Can everybody give me a thumbs up if they can hear and see this video? Okay.
Let's go even further so that we will really feel. I think that the 4 will not allow you to feel that abdominal. Let's go as long as we can, okay? And feel how that's going to be coming in. I feel this coming in.
So in that little clip, can everybody hear me again okay? In that little clip, we're kind of talking about how to sustain the sound and how to really focus that sound as being connected to the body, rather than, again, relying on the throat muscles, which are really not designed to support that sound. By connecting it with the body, and that is going to be the healthiest way and the most effective way to create a louder sound. Here we have something, Alice mentioned the glissando, and here we have that is an actual musical term, as many of you may know. So we have a sung glissando here, and we do vocal slides, and again, we incorporate the body and we incorporate the hands, and really when we get the whole body going, it ends up being a lot of fun too. So we try to again, really minister to the entire system. Here we have vocal slides and hand movements.
Ooh. Good, are you ready? Okay, so again, we're gonna go. Ooh. Good, and one more time. Ooh. Let's do a roller coaster down. Ooh. And one more up. Ooh. Good. One thing that now, so that's great for flexibility of the voice. Two things that we keep in mind is, one is that we want to get all the nooks and crannies, right? This exercise is not ooh, right? It's ooh, whatever the pitch is, we get right in there so that we're really stretching. Ooh. Good, anybody? Okay, sorry.
I think it went back to the beginning. So if you can see, how many of you out there, oh, I don't know if someone, should I be controlling how, let's see, if everybody's on mute or not? Do I have a lot of
the exercises?
You want me to unmute everyone?
Yes, could you, Mary Sue?
Sure.
Thank you. I'm just curious how many people out there are now, actually, I should have mentioned a big hello to some of our members who are on right now. Thank you for joining us. Many of them do have Parkinson's and are here for the information, as well as I told them they might see a little highlight of themselves on video. How many people out there have some experience? Feel free to shout out if you like. Just use your whole body.
I get this. There's nobody here. Could you repeat the question, please?
The question was, I was just curious, has singing experience or
with that group,
sing in a choir?
Yeah, that's. Can't hear your question.
Hi, Cindy. I was wondering if anybody out there who's watching us for the first time has any singing experience, or anybody with zero experience.
Zero
I sang
experience.
in a church choir when I was a teenager.
A community chorus.
Right.
Yeah, when I was in my teen, yeah, I sang in the church choir, and of course in high school too.
I just wanted to let everyone know that really, truly, there is no singing experience that is necessary for a therapeutic choral experience, and in particular ours, that we really try to take you right from the beginning and to connect what the voice does in singing and in speaking with different uses of the voice and of the breath that natural and normal and basic human functions. So we don't want to, I just wanted to tell people that some of those exercises, I hope that for some of you that are singers, you can see how that would be, the word.
How do you make that one?
Mute everybody.
Having a sound like that.
That everybody can take their voice from a lower sound to ooh, and kind of gradually slide up and down. Exactly. So I'm gonna ask if we could mute participants now, and we're gonna move into the next slide with an example of, here we do have a musical pattern, but again, we work also on skills that it takes to sing a musical pattern. So here we have a musical pattern of a note that's going to go up and then down on the scale. Here we have, and so this is a pitch variation exercise.
You want regular eggs? We can come downstairs.
Oh, am I muted?
No, you're not. I accidentally muted you. I'm sorry.
Oh, that's okay.
I muted, Elizabeth, we have to keep everybody muted because it's just way too much background noise. So when you have to ask a question, unmute yourself, okay?
Got it.
All right.
So you can see that we do sit and stand for different exercises, partly just because we don't want to overwhelm the system. And there are many, if you're sitting with good posture, it can be perfectly fine. Choirs also, but that also helps preserve some of the energy. and to create not so much of a physical strain for a practice that lasts about an hour or a little bit longer. So that's some of the technical things that we do and how we relate some of the research and some of the singing exercises to in a choral setting. But also, a lot of this is about having fun. And sometimes my choir members are so engaged in singing well or singing the words or something that sometimes they need a little reminder to have some fun too. So that's where, again, where the director can say, hey, we're here to have fun. Let's add a little bit of personality here. And that always makes everything more fun and even sound better too, and helps the voice to really come alive. That's again something that many Parkinson's, people with Parkinson's as a challenge, that sometimes the voice is not as dynamic and expressive. And so bringing this into the singing is just another way that we can practice that expression. So here's a wonderful clip of a practice that we had. Here is the choir singing a little bit of I'm Looking Over a Four-Leaf Clover.
I'm looking over a four-leaf clover that I overlooked before. One leaf is sunshine, the second is rain. Third is the roses that grow in the lane. Here we go. No need explaining, the one remaining is somebody I adore. I'm looking over a four-leaf clover that I overlooked before.
Song, isn't it? You're saying, hey, I overlooked you, but I see you now. Here we go.
I'm looking over a four-leaf clover that I overlooked before.
Good, sing it.
One leaf is sunshine, the second is rain.
Good.
Third is the roses that grow in the lane. No need explaining, the one remaining is somebody I adore.
Keep it going.
I'm looking over a four-leaf clover that I overlooked before.
That is so much fun. So we have, let's see, there's a little bit, we have a couple of thoughts that Alice had recorded from some of our members. Here's someone on our call now. This is Cindy.
And everybody's so nice. We all get along together.
Yes, we sure do. Yes.
That's great. Have you noticed any changes in your voice?
I think my voice is better, although at the moment it doesn't sound that way, but yeah, it's good for me, I know that.
That's awesome.
Yeah, it's getting stronger.
That's excellent. How about you, young lady?
But when this works with me, I can see by where my pitch goes from real low to where it should be.
Good point.
So we had, I think we've got all those people on the call now. We've got Audrey after Cindy, and then Cynthia at the end, who is saying about how she in particular works on her range. So this helps her to go from a low speaking voice to knowing how to bring that up higher. And so we're just so thrilled that people are enjoying the classes and that they're seeing a benefit that they can bring to their speaking voices and their enjoyment of singing outside of classes as well. Here's a clip of a community outreach performance that we did. And I wanted to just highlight a little bit. When we first started, we were very passionate about bringing vocal exercise in a fun way, in a regular way, in a weekly way to people. But we also, and sharing information and vocal health tips and technique, as I said. But we also were just doing kind of sing-alongs along with that. But we weren't necessarily building some of these skills. And so what we decided to do was that we were going to, because we were kind of functioning as a vocal exercise class, then it just didn't, it seemed like there was the potential for more. So we started to bring out a more choral culture atmosphere to the classes, where we're going to start to work on songs and really develop them and challenge everyone. And in order to inspire everyone to keep working on that, we were going to give ourselves the opportunity and create opportunities to sing in front of others. Sometimes it's just family and friends. We had some small parties, like a Halloween party. Other times we actually had a larger gathering or a formal concert. And here was a community outreach performance. And I think what's so important about a therapeutic choir is not that we're just enjoying the therapeutic. So I say therapeutic choir because we're using music as a therapy for speaking and swallowing and voice problems, that we're using this. But not only are we receiving the therapeutic benefits, but also we want to raise awareness not only about the challenges of some of these disorders, but we want to raise awareness about everything that people can do, even facing some of these challenges. So it's raising awareness about what is still needed to, that we need to learn about it, maybe raising awareness for research, raising awareness for that people are struggling with this, but also raising awareness of how powerful, vibrant, we can be even facing some of these challenges. So behind me, I don't know if you can see, but we have a little, our sign here is part of our motto here that says, Motor City Upbeats, let your voice be heard loud, proud, and upbeat. And we wanted to bring a little bit of that upbeat spirit to our corner of the world, and to live out loud and sing out loud and have a lot of fun doing it, and just really inspire other people. So that's what I think is so important about being in like eventually when we're able to do more community outreach again, it's just so important for us all to realize that there's so much that we can offer, even in the midst of facing challenges. And I think you'll see that this is quite a cute and inspiring performance. Here we have the choir singing, and this is, I believe this is Bicycle Built for Two. And sing along if you'd like to.
Daisy, Daisy, give me your answer too. I'm crazy over the love of you. It won't be a stylish marriage. I can't afford a carriage, but you'll see upon the seat a bicycle built for two. Daisy, Daisy, give me your answer too. I'm crazy for the love of you. We'll spend all our lives together, regardless of the weather. And you will sit upon the seat of a
just think it's wonderful. We had so many wonderful remarks who were just, it brought a smile to their face, or they were tapping their toes. And that's the whole idea, is that music is therapeutic for everyone. So not only do we receive the benefits of the therapy, but now we can share it with the larger community. And that's very a beautiful thing. So the last thing that I just wanted to share, oops, what did I do? Here we go, sorry about that. The last thing I wanted to just show you is our contact information if you would like to know more about a therapeutic choir experience. And so that is our name, some of our contact information, our email. You can also find us on Facebook. You can always call me with any questions or concerns or ideas, or to register for upcoming programming. There is no, Alice mentioned that because of our funding that just came through, we're so excited that we can now offer this programming at no cost to you at this time. So we're very excited about that, because so many people could use a fun, sunshiny spot like this of singing and singing together in their day. So no singing experience needed. All are truly welcome, and you can reach out to us if this is something that you think would benefit you in your life. And I just wanted to thank the Michigan Parkinson Foundation for all of their help and their support in helping us get the word out. And we're also very passionate, not only about our program, but also about sharing this with other musicians and therapists, that this is, that truly becomes something that is available for people all over the nation and all over the world. There are choirs that exist like this. We are not the first, but we really would love to see this as a more commonly available therapeutic tool for people. So please share the word, and please contact us if you think that something like this would be of assistance to you. And thank you so much.
Thank you, Elizabeth. That was so helpful and inspiring. We really appreciate you taking time to join us this afternoon. Alice, we have some questions that we'd like, if you have some time to address them.
Sure.
And
may I just add one thing? I just wanted to thank Elizabeth also and tell her that since we are doing this virtually, there's no geographic limit. If someone lives in Traverse City or someone lives anywhere, they're welcome to join us, because we're all online now. So it's really fun. Okay, yes, I'm happy to answer questions.
Yeah, there was a question about are drooling and swallowing problems related?
Yes, drooling is an indication of a swallowing problem. So it can mean that someone has weak lips, that the drooling is coming down, they're not able to keep that lip seal. It's possible there's an increase in saliva, or that someone is not efficiently, we swallow about 2,000 times a day. So if it's slowed down, or there's some reason why someone isn't swallowing their saliva, or when they're chewing food, they're not able to efficiently chew, some things could be drooling. So drooling is actually a sign of a swallowing problem.
Okay, thank you. If you have a question, you can ask it verbally. Just unmute yourself. Go to where your microphone is. There'll be a red line through it. Just click on it. That will unmute yourself. Or you can type a question in the chat.
It looks on my end that I have 28 questions. 28. So should I just read them and answer them?
Sure.
Okay. I have one. Someone asked about slurred speech. So slurred speech is, we don't use the term slurred because it's so general. As speech pathologists, we're so, there are different types of speech patterns. And so in Parkinson's disease, there is a classic distortion of articulation, and prosody and rate of speech, and it's called hypokinetic dysarthria, and it is the classic dysarthria in Parkinson's disease. So yes, changes in speech do occur with PD. I hope that answers the question. Someone said something about a resource they found about awesome social experience for participants with the choir. And I can't read. Someone had a question, but it doesn't show up. So any other questions? If I haven't answered your question, please.
Yes, Alice, I have a question.
Go ahead. Go ahead.
Okay, I don't know, but when I go to like chew some hard bread and sometimes it doesn't go all the way down, and sometimes it just gets caught in somewhere in the esophagus. I have to like get something to drink and get it down. So is it caused from like yeast, or do you think I'm allergic to the yeast, or do you think, or something that
I don't
might
think
cause
it's related to the ingredients you're eating. And so that would require going to a doctor. Sometimes the esophagus has a narrowing part to it that sometimes requires more water to be swallowed while you're chewing or swallowing. And that's not an indication of Parkinson's disease. That can happen in anyone. So, but if it does happen, I would say to see your doctor. And sometimes it's just a matter of chewing slower, giving more time between swallows to let food go down if it is a little slower.
Do you think I should take some small bites and swallow?
Small bites and small sips are good to see if that helps, for sure.
Okay. Okay.
Okay. Anyone else?
Any other questions?
Question, please.
Yeah, go ahead, Dan.
Thanks for the fantastic presentation. I was intrigued by your original comments about muscle coordination, and I was wondering if increased dose of carbidopa-levodopa medicine would affect throat muscle coordination.
That's a really good question, Dan. I don't know of any research that's looked at that specifically, but we do know, for instance, with deep brain stimulation, when the electricity is increased to improve motor movements, the speech worsens.
Oh.
So it's really difficult to get improved physical coordination and improved speech through DBS. Typically the changes, if someone ups their levodopa, I'd have to do more research. The speech and swallowing mechanisms are so much more finely tuned than the more gross motor movements.
Oh, I see.
That it requires a lot of different things to improve them. For instance, some studies with DBS are looking at inserting the leads in different areas of the brain that will create more of a balance between speech and physical motor movements. And so I could look it up and get back to you, but my first response is going to be that just by increasing levodopa, you might see improvements in your physical well-being. It may not affect your speech or swallowing.
Okay, thanks. I know you have enough on your plate to not research another obscure question, but I do want to make one more comment that I'm an old friend of Cindy Bakken, and she's been encouraging me to join the choir, and this presentation has convinced me to join.
Yay!
Yay!
That's
great.
That's so good. We like to have new people.
Yeah.
Awesome.
Always fun.
Yeah.
Dan, I will email Mary Sue. Is that okay with the answer to my
question?
Oh,
yeah, sure.
To your question? Yeah,
email me and I can get the information to Dan. I know Dan well.
Perfect.
Okay. Okay, I think we've got time for one more question, and then I've actually got to scoot. I have to get to the real office, leave my home office and get to the real office. So time for one more question. Either.
I have one more, Alice. When
okay.
you know, when I get like anxiety or anything else like that, sometimes I tend to like slur my words a little bit. The words don't come out as good. What do you think?
That is sometimes that happens as people are hyper anxious because you're just thinking so much and not really think about what you say. But again, that's probably unrelated to, well, when people speak quickly, there's a tendency to distort articulation, no matter what the condition.
Okay.
Yeah. Okay. Anyone else?
Great.
Thank you.
I think we're good. Alice, thank you. Elizabeth, thank you so much for your time. You know, at one point we had 67 people. Yeah. So obviously it was a very important topic. I hope you will all join the choir. Obviously, you've heard of what the wonderful benefits are. Dan, glad to hear that you're going to be joining.
Fun.
So, thank you all. I'm going to leave the meeting.
Thank you.
We did record it. We post all of the recorded programs on our website. We have a YouTube channel. It takes 3 or 4 days for us to get this converted in the right format so that we can host it on the Michigan Parkinson Foundation's YouTube channel, okay? So give us a couple days and then check the website. Again, thank you all and have a great rest of the day.
Thank you.
Bye.
Bye-bye.
Bye-bye.